Welcome back to the Expert Talks with VTL. My name is Vietang. I'm a country manager of VTL Aesthetics, and today would like to welcome two very special hosts. First is Dr. Tô Lan Phương. A second person I would like to introduce is Mr. Tomas Boleslavsky, Clinical Director of VTL Aesthetic and VTL internationally. Dr. Phương is actually focusing on the down part area, which is for the face and the submentum area. For Asian patient, as a lot of Asian patients, they look into the phone and stuff like that. I think that the double chin or down part area is very important. Can you share a little bit summary? What are you actually doing? What are you focused on?
My patients not only care about the skin rejuvenation, but also for the skin quality, especially for the lower part of the face. And when EMFACE come, they target like the only device target into the muscle. They see that for the lifting area, especially for the jawline, the nasal level 4. Not only that, they can also improve a symmetric symptom. And just only for 4 seconds, you can see the result already. Some patients, they also get the result after 2 weeks, 2 seconds.
A lot of people did not get the idea that actually is the only treatment in the world which can naturally make your muscles more firm. Our philosophy is to perform the functional treatment. Of course, we are talking about the beauty business, so people want to look better. But what we are proud of, that it's functionally improving the health of their facial structures.
But in terms of clinical studies, if I'm not wrong, in Asia, I haven't really seen that many doctors who's actually presenting results or measured results for the down part for both submentum area and face area. Tomas, have you noticed any direction on this way yet? Or
well, internationally, with our US KOLs, we did some research on that. But I think in Asia, it's the first time you precisely analyze the moves and changes over the facial structures. So volume, lifting and tightening. But also what I like that you pay attention to the texture of the skin and the quality of the skin, because we're talking about metabolism. So basically you make the skin processes more active, more healthy.
Now when they see the actually measured, what is their first feedback of your patients or your clinical patients?
Yeah. For my patients, whenever we take off the applicator, they say, wow, immediately. They usually ask me, hey, doctor, is it stay there or the result go away? But after that, I use the quantification system image to evaluation the result, make it transparent and objective. And we can see like after week 2, week 3, and week 4, the result is more and more. So I will compare the result for my patients so they can see clearly how it works. For EMFACE, you see it hitting all layer of the skin, but without painful. It's like 20 minutes sleeping and relax. And after that, they see, they wake up and like more fresh, younger, time by time. When you smiling, the muscle will lift up, and the muscle is on the skin tissue. It will aging with time. And when it's aging, it will get uneven, like one side is aging more than the other side because of chewing habits or sleeping position or any wrong procedure, aesthetic procedure. After we do the treatment, not only we lift up the face, but also we rebalance two sides to get the harmony result. They very eager to treat the asymmetry face even more than skin rejuvenation, because that is the only device can treat that symptom.
Yeah.
So do the BTL get the official protocol for specific indication, or just the same for section every 4 weeks?
Well, actually, it very much would depend on the reason why the asymmetry is there. If it's, as you described, the aging process, sleeping habits, stereotypes of moving the muscles during the mimetic action, then usually the standard 4-session protocol is okay.
Yeah.
What is different is the strategy during the treatment. If you see the asymmetry of response of muscles, different muscle action, then we can adjust the parameters differently for every one of 3 channels you're treating with the cheeks and submentum. If you would be treating somebody which may be after injecting, after stroke, after infection on the facial nerve, they may have some level of paresis. So there can be physiological diagnosis of asymmetry. Then you may need more sessions. If you got something extraordinary, medically actually paralyzed, then you may need 6 or even 8 sessions. But this is medically very unique situation because nobody ever was yet treated efficiently by energy for this kind of indication.
When my patient come to me with the EMFACE, just focus on rejuvenation and regeneration, like lift up the skin, especially for the muscle layer. If we just target on only one layer, as before, we just use to stimulate collagen only, or sometimes we just use toxin. Everywhere with toxin, or we just focus on filler, something like that. So now our patient needs a more natural and long-lasting result, and especially very natural one. We cannot treat everything if we got the physical disease, but with aging, we can rebalance the muscle two sides.
We do the natural thing, which like is a training of the muscle, which is aging. And then this doesn't hurt if you do it properly, because this is something our muscles are designed for. I don't know any other procedure which is actually able to heat skin, connective tissue with the smash, and muscle at the same time. And on top of that, keep it for 20 minutes. That is the reason why we rejuvenate and we make the tissue act like younger, more functional. And that's why in 3-4 weeks, 2 months after, they look even better. Because every day as we talk, as we move, we are using these muscles. But they are like trained. It's like going with your face to the gym. And then the muscles respond to everyday action better. And that's how the results can improve with the time. Your body is functioning better. And because of that, you look better with no pain.
That's why I love EMFACE.
Happy to hear that.
Yeah.
The key is you have to find a patient which is aligned with our philosophy. But a lot of people, when they see how much we can do functionally with their face, especially people with asymmetry, they may be very loyal to us because they say, this is what works. I see it's healthy. I don't want to interfere with the results. They see that their partner is saying, you look fresh, honey, have you been sleeping better? And then when they're loyal to that, this is the only way how to convince them not to get Botox, not to get any other EBDs.
For the EMFACE, what is very specific, or what is, I think, very specific for EMFACE, that we know how to target correct muscles. It was always about elevating muscles. But for eyes, sometimes it's confusing because you put the eye applicators under the eyes. And a lot of people, even me, I didn't know that actually under eyes are the elevating muscles. I always thought that under eyes are the muscles which are pulling the eyes down. Maybe can you open up a bit about the eyes applicators? And
if you imagine you got a little bit of the fat here, with the lifestyle, it can get swollen and bigger. And then we have these eye bags, which nobody likes, and the dark circles. Now the muscle is in front of that. So if there's too much of pressure and the muscle gets weak, you got these eye bags. And then the muscle itself is not pulling anything down. If you stimulate that muscle, they're moving this way. And they pull back, they support. You got a very healthy effect of lymphatic drainage and lower the volume of that fat. So at the end, the fat pocket or like these eye bags, they get firmer, but you don't pull anything down because we stimulate strictly this portion, not that one.
Dr. Phương, I think that you can agree with me that Asians' eyes, I think eyes are for us one of the most important area for the Asian. So for sure, you probably start to use the eyes applicators in your practice, in your clinic. What is so far your experience with the eyes applicators of EMFACE?
It's amazing because I feel because I'm very chicken, I'm scared of the pain a lot. So I know painful, very relaxed. And after that, I see my eyes look like more open and refreshed. So our eye area will aging first in our face. So after we do the treatment, so we can see like stimulate the orbicularis, oculis muscle, and then it's stronger and lift up. Because this area, the function of the muscle is close our eyes. And after it have the facial, it have the muscles younger, we less to use the toxin for these areas as well as for this the teardrop. My patient asked me, doctor, do one more section for me. The patient asked me for that. So now we do the treatment 40 minutes, 20 minutes for the lower face and 20 minutes for the upper face. Yeah, and then I see the result even better. Maybe it's connected to each other. That's why we call it connective tissue.
That's why we do the combination of this beautiful treatment on the lower eyelids with the forehead, because that muscle is actually responsible for lifting effect all of the lateral aspect of our eyebrows and our eyes. And since we aim not for contractions, but for toning of the muscle, when we don't physically activate it, it stays toned. So it looks like we slept better, we are more fresh, we are full of energy, and the eyes are more open, more visible, brighter, they get more light. And that's the effect the patient sees immediately. And that's why people say, hey, have you slept better? Have you been having holiday? It's not that they don't see that the procedure was done. They see that you are yourself younger, fresher. Well, it comes from philosophy of doing it physiological way. We try to respect how our body is designed. And it's especially true for those delicate areas and muscles. You don't feel the stimulation of the muscle, the hyphas, the energy so much on the eyelids. You feel more the heat because there is thinner skin. But there's nothing painful. Actually, it's soothing sensation, and very often you gently wake up the patient because they are so much enjoying that they're dozing off. So that's why I think many methods are struggling, because with aesthetics, there is this rule, no pain, no gain. We absolutely do not follow that. We want to go for the very healthy way, which is usually not painful.
From BTL, we're very excited actually to follow up on your results from your clinical study, especially the 3 months, 6 months, or maybe even 1 year, because this is something what we really like, clinical studies and before, after. So we wish you good luck with that, and we hope that we'll be able to see very nice results in the next coming months and this year, next year.
In conclusion, EMFACE one of the technique I love the most because it is science-based and well-studied, and most importantly, it respects the natural of our beauty and no downtime and needleless. So that's why EMFACE is one of the technology will changing the game in aesthetic industry.
Well, if I should say something, it sounds that it's a great treatment and it's very easy to perform. I'd like to thank you very much for being that professional and caring that much about your patients.
It's my pleasure.